I just enjoy that intro so much. Welcome to the Pivotal Podcast. Today we're joined by Dr. Justin Pykare, a dedicated nursing leader and health informatics expert with a rich background in clinical practice and innovative healthcare solutions. In this episode, we'll explore Dr. Pykare's career journey, his current projects, his contributions to health informatics, and his passion for reducing burnout for healthcare professionals. All right, Justin, thank you so much for joining me today.
Yeah, thank you for having me.
Yeah, I'm super excited to have this conversation. So let's dive right in. Just tell us all first off, tell me about the work that you're doing right now.
Yeah, so currently I work for an FQHC called One Health Ohio and Rise Recovery. And I am the health informatics director as well as a family nurse practitioner. And together in both of those roles, really serving the underserved population in Northeast Ohio. And it's really rewarding work.
Yeah, that's awesome. Tell me a little bit more about that. Like, what do you love about it?
Yeah, so I mean, every day there's something new in both the informatics side as well as the medicine side. There's never a boring day. You have so many different types of people. And from one room to the next, there's always something new. So that's what I love, always needing to investigate, solve problems, solve those puzzles. And that's kind of what keeps me going.
Yeah, that's awesome. What about something you don't love? Is there anything you wish you were different about what you're doing right now?
I would say in medicine in general, the time is always something that you just don't have enough. There is so many patients that need help that in the structure, the way medicine is, we aren't given the amount of time that we need to be able to spend with patients. So if I could change anything, that would be one of them.
Yeah. So more time with individual patients.
Absolutely. Being able to spend that one-on-one time with them, discussing, talking, coming up with goals, those types of things. You really have to be innovative in the way that you are addressing these topics with patients so that you're able to really get a lot of information covered to them in a short amount of time.
Yeah. Yeah, that makes a lot of sense. So let's just rewind a little bit. Tell us how you got here, right? So you had early experiences as a junior firefighter, EMT, right? Like, how did that kind of set things in motion for you to wind up here?
Yeah. I would say in general, my passion for healthcare was a calling. It's something that from a very young age, I knew I wanted to be a part of. Didn't necessarily know exactly what that would look like. I would say my personal experiences probably helped shape that as well. As a young toddler, I was hospitalized at a young age, which I don't really remember. I just know the stories that were told to me about that. And it was kind of a mystery around it as well, that the initial diagnoses weren't great. My parents were scared. They had talked about leukemia, different cancers, those types of things. And then I ended up being diagnosed with a blood disorder called ITP, idiopathic thrombocytopenic purpura. And basically the gist of that is that you have low blood platelets, you have a high risk of bleeding, lots of bruising, those types of things. And my episode was an acute episode. Hospitalized for a couple weeks, treated with steroids and plasma, those types of things, and platelets. And then thankfully I've been in remission since. I haven't had any issues since then. But I think that was probably part of the reason, hearing those stories and that seeing those pictures kind of catapulted me to wanting to help others. And then, from a very young age, I wanted to get involved with helping people. So at the age of 16, started as a junior firefighter, started learning, all the ins and outs about that, and just had a real passion for serving my community. And then right out of high school, did training to be an EMT, stayed on as a volunteer, and then worked paid services through nursing school as I went on to continue my education that way.
Wow, that's phenomenal. So, okay, so you went through nursing school and then what?
Yeah, so nursing school, I started off with my associate's degree, and then from there started directly into the intensive care unit as a staff nurse, and really loved that part of it. I always knew I wanted advanced nursing. I didn't know if that would be anesthesia versus nurse practitioner, but as I worked through the critical care part of it, I knew I could and wanted to make a difference for patients. So once I saw them in critical care, I started to see a reoccurring theme. One, they had preventative health issues. All of their issues for coming to the intensive care usually focused on a chronic condition that could have been prevented, right? So that was a huge part of my motivation to go back to then become a nurse practitioner, focus in on preventative health care and primary care. And then in addition to that, I also felt this strong sense of the need to discuss and prepare patients for end of life as well, because I had so many patients and so many families who unfortunately found themselves in those situations and never had the conversations. And they're very difficult conversations to have, especially when a lot of pressure is put on the family. And then those family dynamics and stress add so much to that situation and puts a lot of pressure on people when patients are suffering at that time. So those were really big motivators for me to continue on in my education. I ended up getting my bachelor's degree a year later, and then applied to my master's degree program for family nurse practitioner about 3 years in as a staff nurse. And then that took about 3 years to complete. So at the end of graduation, as a family nurse practitioner, I had 6 years of critical care experience, and then started into primary care from there.
Wow. What you're saying makes a lot of sense from your experience and how that shaped what you wish were different about medicine right now, right? Because you mentioned earlier that you wished you had more time with each patient. And one of the things you said you wanted to do was talk about goals, right? And so if people are really suffering and dying ultimately from these things that could have been prevented, it makes sense that now in your day to day, you want to be proactive in helping people prevent those things.
Yep, exactly.
Wow. Wow. So how does that connect with informatics?
So, I mean, my informatics type of experience started back in the intensive care unit. So I was part of, an EHR transition. We had gone from paper to the electronic health record and started as a super user. And that was my very beginning of knowing what informatics was, and spent a lot of time getting to know the program and getting to know how to approach educating people as far as using the EHR, especially when this was a brand new. So going from paper to an EHR is a huge step. And then, kind of moved on from there as far as continued to be the super user on the unit while I was in the intensive care unit.
Wow. So a lot of what I hear in like conversations like this, it seems to come back to, well, I had hands-on experience operating this system, this EHR, right? And I kept diving in, or I kept saying yes, or kept raising my hand for other opportunities, right? So you've got the EHR transition, you're learning about informatics there, and then you start to educate people in what it is and what it can do. How did that lead to becoming the inaugural health informatics manager at One Health Ohio?
Yeah, so we were going through an administrative transition at One Health Ohio, and I was picked by our chief medical officer. She found and sought in me, I think, the efficiency in the way that I used our current EHR, and really sat down with me and talked about the idea of what the health informatics manager position looked like. When she approached me, I really didn't know, much about that or what the idea was. But the more we talked about it, it was everything that I was totally interested in. When I was back in the ICU, I was actually approached by the informatics team to actually go into informatics then. But that would have required, uprooting my family, moving to a different city. I was already in an advanced program with my nurse practitioner, and it just didn't feel like the right time. So fast forward, 3 more years later, here it is again as an opportunity. So it was really, really an interesting conversation having with her about that. And she forward thinking, had the ideas and saw the need for that in our organization. As an FQHC, Federally Qualified Healthcare Center, we are really scrutinized in the way that we have to report to the federal government, and we have multiple different health measures, and the data that comes along with that is, overwhelming. So we needed to have a strong program and a strong leader to help with improving efficiencies and utilizing the HR, improving quality outcomes for our patients, and then being able to show the work that we had been doing.
So how did she initially, like, if you can remember at this point, how did she cast that vision for like, okay, this is what this is going to look like for you? And you were like, yes, that's exactly what I want to do.
Yeah. So, it was a group effort, right? I did a lot of research about what the role would look like. She had, the outline of what job expectations were. She set some pretty high expectations as far as some goals as well, that we just really worked together to achieve those goals. And then really instrumentally was the entire team that she put together. So, not only was my role new, but she had brought in a chief quality officer who had an extreme amount of experience in private practice as a pediatrician, and had a great eye for detail. So we worked a lot together, pretty instrumentally together to improve workflows and efficiencies. She also brought on, a population health team who helped with identifying these types of core measures and improving patient outcomes. So it was a huge overhaul in the way that we were delivering care that was all brought to a head by our chief medical officer.
That's awesome. I feel like I hear that a lot too, that informatics entails a lot of different things. But a couple of the key things are improving user experience and then also improving patient outcomes.
Absolutely. Those are, the forefront of the things that are on my mind when we're looking at, new projects, new initiatives, those types of things, or when we're reviewing data and seeing where, there might be ways to improve certain processes and things like that. That's what it comes down to is, your patient and the outcomes of what we're able to provide for them.
How long have you been in this role now?
So I started at the end of 2018 as the health informatics manager, and then promoted to the director after that.
Yeah. Okay. So in that time, are there any key projects or initiatives that stand out in your mind as having made some of the most major impact, either in operational efficiency or patient outcomes?
Yeah, when we first started, there was so much work to be done. We were behind on EHR upgrades. So upgrading that to the most up-to-date version was one of the first steps. And then in addition to that, it was a lot of cleanup. It was simple yet very effective things that we were able to do, like creating document types for specific items. So, we had an electronic folder for images, but all of those images were listed as an X-ray. So you could have 10 chest X-rays, but you were looking for an X-ray of the arm. You had to look through all 10 of them to find the one that you needed. So we individualized these, document types to make it easier for clinicians to find the things that they needed to find. We implemented safety measures within the EHR, like Tall Man RX. So creating these types of safety measures within the medication module for sound-alike, look-alike drugs, so that specific letters of them are capitalized and they stand out to you, so that you're reducing your risk of medication errors. Another initiative was implementing what's called electronic prescription controlled systems. So EPCS is where we are able to prescribe controlled substances electronically rather than writing them on scripts. And that process was difficult because you had to log the script, you had to make a photocopy of the script, scan all that into the system. Now we have a two-factor way to send it securely to the pharmacy electronically, which significantly improves efficiency. So those were some of the top ones. And then in addition to that, we also did a patient portal. We had a patient portal implemented. It wasn't widely used. So we implemented, researched for different types of platforms, and then implemented a patient portal that really helped boost patient communication, access for patients to be able to communicate easily, request, appointments and those types of things.
Just reminded me, I need to go on and request a refill today to my patient portal, actually. Spending a lot of time in my patient portal today. I got an email with a bill on it as well, and went in and just paid. Super easy. That's great. Yeah, so those are very convenient impacts for me as a patient. What about like improved care? Well, I guess that's still care, but improved like healthcare outcomes. Have you seen those through your informatics efforts?
Yeah, absolutely. So through informatics and the team in general, we've been able to secure what are called these HRSA. So from the federal government, we are monitored through the Health Resources and Services Administration, and they give out or award these different type of awards each year based on patient outcomes and quality. So not just informatics, but as a team, in general, from across the board and through One Health Ohio's Chief Medical Officer direction, we've been able to secure multiple national leader awards from HRSA, including the National Quality Leader Award in 2021, which was gold. So that's the top 10% of, clinicians in the United States, as well as we hit what's called advancing HIT for quality. So using health informatics to provide patient quality outcomes. And there's a few different components to what that means, but some of them are offering telehealth services, which was new for us, allowing patients to engage with us electronically, engaging patients through health IT, and then also screening for social risk factors or social determinants of health. And we use, screenings for that and documentation and follow-up to help address those patient outcomes.
Yeah, that's huge. So you mentioned creating telehealth, right? And you guys did that during COVID, right? Can you walk me through a little bit? What was that process like? And then what's been its impact?
Yeah, absolutely. So prior to COVID-19, we didn't have any type of telehealth services. And overnight, things changed for the entire world. And specifically for medicine, we had to adapt, and we had to adapt quickly. So yeah, myself and the chief quality officer led the charge in creating a pretty robust telehealth service program that helped really provide the access that patients needed. I'm proud to say we never shut down during COVID-19. Our CEO and CMO were very, adamant about being safe, but being able to provide the services that our patients desperately needed during that time. So this chief quality officer and myself worked to secure a platform to use for telehealth services. And then, the biggest part was, creating the workflow and then dispersing the education for, all of our clinicians and support staff, nurses, front desk, all of those key components, and getting them on board and their buy-in to really get it moving. But yeah, we were able to create that and get it moving and implemented within 2 weeks. And, during shutdown, when, that first 2 to 4 weeks where it was really severe, we were able to provide the care that we needed for our patients. And then since then, we continue to use telehealth services in everyday life. Specifically, a lot of it is within our substance use disorder clinic, Rise Recovery. So, we continue to use it in primary care as well as in our Rise Recovery services.
Wow, that's awesome. That's super good. So it sounds like you guys were able to find a good bit of technology that already existed, right? And then integrate that in, and then have to build some workflows around it probably.
Yep.
So are there other key technologies that you've implemented that you've seen, I guess, in your time kind of in this whole informatics sphere to address a huge topic of concern that I feel like is a direct result of COVID, and that's clinician burnout? Have you found anything that's been effective at improving, operational efficiencies or reducing burnout overall?
Yeah, so it's a huge buzzword in informatics and in medicine. It's something that I don't think is necessarily new to any of us, but something that has been maybe brought out to light and talked about more, which is good, and we need to continue to do that. One of the main ideas and points of health informatics is to improve efficiency, right, for our clinicians and our end users. So some of the ways I approach that is we do quarterly to biannual surveys for our clinicians, and we really try to get a pulse on what they're feeling, what pain points they're having, and what ideas that we can come together to create to help improve that process. I think a lot of it is about also educating on what is and what are things that we can change and what are some of the things that might not necessarily be able to be changed, right? That's one of the biggest things as far as maybe acceptance. Those are things that we have to accept as clinicians at times.
Can you give me an example of something you could change versus things that can't be changed?
Yeah, so I would say like certain regulatory things, there are maybe check boxes that are annoying for certain workflows, but there's something that needs to be there so that we're not held liable for certain things, maybe something of that nature. I would say I created a monthly, what's called Hit the Target meeting for my clinicians, where we meet virtually each month, and I choose either a workflow or one of the measures that we maybe be slipping on as far as compliance with, and then really just work around those to help give them tips and tricks on ways to improve their workflow, how they can improve from their side as far as getting their scores up and then getting their patient outcomes improved as well. That in addition to, I would say, really implementing the EPCS. That was one of the biggest things, I think, as far as getting the controlled substances approved, as well as the automation of certain things as well. Any way that we can help improve that efficiencies, reduce clicks, it's going to help improve, the clinician workflow.
Yeah, totally. Speaking of automation, what role do you see AI playing in the future?
Yeah. So such a huge topic. We could spend a whole podcast talking about, I'm sure. It's been here, it's been
lurking in the background.
Yeah. And, and then out of nowhere, a big boom. They're really pushing as far as some of the mobile devices that are available. And I think it has a role for sure in healthcare, and it's not going away. We have to know how to regulate it, I think, is a big concern for a lot of people. But it certainly has a role in, and will continue to grow its role for sure, specifically if we can prove that it is, something as a tool that can improve patient outcomes. I'm all for it. If it can help with clinical decision making, those types of ideas and plans, it's going to be good for both clinicians and for patients.
Yeah, that makes sense. And it's I guess you kind of hit the nail on the head there too. When you talk about improving patient outcomes, that addresses I feel like what I keep hearing about is the major concern is the balancing of the risks versus the improvements that are offered, right? The risk versus reward kind of thing.
Yeah, exactly. And I mean, that's nothing new to medicine, right? I mean, we have exponentially grown in a very short amount of time in medicine in general. I was very, very blessed to be able to work under an intensivist, Dr. McGowan, who he was a World War II flight surgeon, and was practicing internal medicine, in the 70s, and continues to practice now. And he has seen the evolution of medicine, and I have been taught in the way of using your hands as much as possible, right, to diagnose, and then leaning on the tools that we are very fortunate to have to help confirm that diagnosis or to exclude that diagnosis, right? And so we have CAT scans, we have all kinds of different technologies that we can use, but it doesn't replace what the clinician should know in their brain and what they should know in their heart, and giving that compassionate and passionate care.
That's huge to have somebody who's had such an extensive amount of experience and gone before you and seen how things have evolved, because I feel like they're able to speak from, hey, these are the core tenets that never change. Like over time, these are the things, these are the principles we always go back to. And it's how you're doing the right thing, basically, ultimately, because they're the time-tested, like tried and true things, right? So how has that shaped, and I'm assuming maybe that's been part of it, your commitment to working with students? Tell me about that, like what it looks like for you to work with students now.
Yeah, I love working with students. It's rewarding. I mean, they teach me things. I teach them things, and I think that's something that's important for all clinicians to understand that your learning is never done. You're always pushing yourself to learn something new, and you can't know everything, especially in today's world, right? So in the 70s, there may have been 3 or 4 antihypertensive drugs, and now there's tons and tons, and you can't keep up with the changes that are coming. And so I think that's important for students to understand, and that's something that I like to show as evidence as well, because when they may ask me a question and I don't know the answer, I'm not going to, pretend like I do and give them some sort of answer, that made up answer. So, I'm very direct with them and letting them know that, a good clinician is someone who knows what they don't know, and they're very much, and should be engaged in finding answers from different sources, or reaching out to, the consults that they need to look at to get that information they may need.
Yeah, totally. What capacity are you working with students in now?
So I work as a preceptor. So we take students here at One Health Ohio, and then I have, affiliations with certain schools as adjunct faculty because of that. And so, yeah, it's a lot of hands-on direct clinical care with students, and it's fun to see their progression. So I have students who it's their first clinical and their first experience, and then others who have had other rotations, and they're near graduating. So you get different varying degrees of comfort and knowledge base. And so as the clinical instructor and the preceptor, it's my duty just to continue to set those goals, push their limits, and then give them the experiences so that they can continue to grow and see the impact that they can have.
Yeah. And are these clinicals, are they part of like an advanced practice program?
Yes. So my students are all nurse practitioner students.
Okay, cool. And what kind of rotations do they go through?
So they have different rotations. When they're with me, it's all primary care. So that's what they're seeing when they're with me. But they will do all of their primary care rotations, and then each school is a little bit different on what they recommend for specialty rotations, like cardiology, endocrinology, women's health, things like that.
Okay. Does informatics play a role in what you're doing in terms of your work with your students?
So they get to see it, absolutely, because that role never ends, and it's always coming through, even when seeing patients and things like that. So yeah, they definitely get a taste of what my job entails, as far as the balancing act of giving clinical care, as well as all the other administrative duties that come along with the health informatics job.
Sure. And I'm sure your experience in informatics has probably shaped how you conduct your clinical care, right? You're like, hey, so this is how you can use the EHR really effectively in, your time with your patients or afterwards or whatever you're doing.
Yeah, it's huge. This role has impacted me in many ways, in the way that I give clinical care, in the way that I help students understand, the idea of being the clinician and what we serve, what roles we serve in medicine. Even, what I see when I take my kids to the doctor, right? It's just an eye-opening experiencing for, from start to finish, from different aspects, from patients to the clinical side.
Yeah. Yeah. We're all consumers of healthcare at the end of the day, right?
Right.
Out of curiosity, how old are your kids?
So I have 4 children.
Wow.
My son, he's 9, and then 3 daughters, 7, 5, and 2.5.
Wow, cool. Okay, so I have 3 kids, and my daughter's 8, and then my sons are 5 and 3, almost 6 and 4. So at this stage, we consume a decent bit of healthcare because kids are always getting sick or hurt or whatever it is, right? So I'm super, super grateful for our nurse practitioners and the EHR and all these things that I get the benefit of from the patient side and the parent side of things for sure.
Absolutely.
That's awesome. Do you find yourself time and time again answering similar questions, or does the same question come up from students that you work with?
I'd say maybe themes.
Okay.
There could be reoccurring themes, and one of which would be, how do you communicate with patients? How do you stop them from talking? Right. So some patients will come in with a list of complaints, and how do you prioritize those things? Right. So that's one of the biggest ones, especially when things are always on demand and we expect results instantly. That's something difficult for patients to understand and grasp, that these chronic conditions didn't just appear overnight. They were, they have been ongoing for many years, and just keep adding up, and then your symptoms may have just progressed, and now it's become a worrisome thing for you. There's not a magic pill to resolve all of those things that have been done over the years. So really getting patients and students to understand that this is a slow process, but it is something that can be managed. And we have to go back to those goals. We have to set goals, short-term goals, and come up with a plan together. So I'd say that's a huge theme. And then going back maybe to the burnout aspect of it, I really like to make sure that students understand that we have a responsibility to our patients, but we are not responsible for our patients. Right?
Yeah, that's huge.
Yeah, and so what I see and what I have seen a lot is that there's a huge amount of burden on clinicians, and they take it personally when their diabetics aren't controlled, or they're not doing the things that they have told them to do over and over again. But there's only so much that we as clinicians can do, and if we continue to take all of that burden onto ourselves, it will eventually weigh on you.
Yeah, but boundaries are probably really important, right? Like knowing, hey, what am I able to control, and then where does that end, so I don't try to take on what someone else is responsible for and that I can't actually control, because that's when I'm going to experience really an increased and undue amount of stress, right?
Absolutely. Yeah, boundaries are huge in practice, and then in addition to the informatics part of it as well. You could spend so much time out of the office, finding ways to improve different processes and different things. And when I was working on my doctorate, I found myself consumed in full-time work and full-time and school and family and those types of things. And yeah, it's something that you have to always have a pulse on as a clinician, to know where you're at, and then how do you work, to keep yourself stable.
Yeah, that's good. So speaking about things outside of work and burnout and everything, as a dad also, I'm always kind of thinking about this, right? But how do you balance that, like work, life, burnout, all these things, like with all the hats you're wearing, right? What's your inside advice?
Yeah, again, no secret pill. I would say
take lots of pills. That's how I juggle all of these things.
I'd say faith is probably my biggest steadfast. It's my center of everything that I do. And, you know, any time where you start to feel overwhelmed, knowing that you're part of something bigger is, you know, kind of what keeps me going. So that's number one. And then I would say number two would be, you know, staying active and exercising is huge. It is so good for you physically, but so good for you mentally. And the amount of natural endorphins that are produced through physical exercise has such a benefit on being able to, you know, reduce that repetitive stress that we all experience every day.
Yeah, I'm definitely right there with you on the faith aspect of it. Actually, I've got this card sitting next to me, and I love it. And a friend left it on my desk one day, and it says, "I pray and I believe that your hard work will be rewarded soon." And then the verse is First Chronicles, chapter 28, verse 20. It says, "Be strong and courageous, and do the work. Don't be afraid or discouraged, for the Lord God, my God, is with you. He will not fail you or forsake you." And I think that's really important. It's spoken so much to me just because like sometimes stuff we're working on is really, really hard, but we're like, oh yeah, I got into this because I felt called into this. And this is, you know, and obviously people have different beliefs, but like for me personally, that helps me a ton. Right. So I'm right there. What my question is when it comes to the exercise and juggling work and parenting, like how do you find time to fit that in? It's like, oh, I play with my kids really hard and that's fine, but it's not quite the same as like, oh, I hit the gym 3 times this week.
Yeah. You know, it's different for everybody, right? For me, it's not as much as I would like. I'm always trying to find a way to get that exercise in more than I could and I should be doing. But yeah, I mean, I don't get enough sleep. I can tell you that. That's one of my faults for sure. For health, you need your sleep, and we should be sleeping at least 7 to 8 hours a night. I'm lucky if I get 5, right? So going to bed before 1 a.m., not unusual for me to be up at 1 doing different things. So I try to get myself up in the morning. Doesn't always work. Sometimes after they go to sleep. But where I really find I'm able to get the exercise is on the weekends a little bit more. And then I love to incorporate it with the kids, right? So I think that's huge as parents as well, is to model that exercise and that active lifestyle for our kids to learn and to understand. And so, you know, they love running with me. They'll run a mile out of my few miles that I'm running. They love lifting weights and doing bands, those types of things. So anything to incorporate them is always fun.
Yeah, that's awesome. That's super good. So I want to go back a little bit to something you said, because this is personally important for me in my recruiting work. Sometimes I get stuck in a really long conversation when I have a limited amount of time, right? So what do you tell students when they're like, how do you get out of these long conversations so you can actually move forward and, you know, provide the care that your patients need, right?
Yeah.
When they want to keep talking with this laundry list of things that may or may not be relevant to their ultimate needs there, when you have a limited amount of time to do it.
Yeah. I mean, it's a finesse. You have to be compassionate and you have to show them that what your heart is, right? Especially if it's your first time meeting them. And that's usually where it happens, is on your first encounter, because they've saved all of these things and they want to use that time because they know it's limited in order to get everything that they want. So it's important on tone to express the tone that you hear them, that you're here for them. But, you know, these are the short-term goals, and then be direct. Identify, ask them what are the most important things out of the list that they've given you. What are the most important things? What are the 3 most important things you want? And then I evaluate those based on what I feel are the most important things or the best things to address, and then come up with a plan. And then I think what's really important also is just to do a real quick recap so that, you know, they're able to kind of understand, you know, what your goals are and what they're responsible for. So in primary care, we know studies show that they really only retain about 20% or less of what we actually tell them during a visit. So, you know, it's really, really important to use your voice, but informatics comes, in again in the clutch to be really important in the way that you document succinctly and at the level that the patient will understand too. So when they're going back after the visit and rereading, what you wrote, what you talked about, it's there for them to really understand.
Is this just occurred to me, but is there AI for that like takes the medical terminology and just simplifies it for the patient notes and takeaways? Do you know? Any idea?
Well, I know there is AI technology that basically records the interaction and will put it into like a note for the clinician, and without you even having to write your SOAP note or anything like that. I'm not exactly sure about what exists though on the patient aspect of it. I'm not sure.
Yeah. Yeah. I mean, it just makes sense to me because like I use ChatGPT all the time, and I know that I could take something really complicated and be like, hey, explain it like I'm 5, and put it in there. But I
Right.
didn't know, because I know regulations come into play, right? Because it's people's health and safety that's at stake here, right? So I wasn't sure if there's been something identified like that that's already in use that says, hey, great, you've done this with these clinician notes, right? But now put it in the top key takeaways for the patient, so and in a way that they can understand, right? So that's
Right.
what they see in their patient. They can see, if they want to see the original, like they can see it, but then they can see like, here's the summary, here's the takeaway, because then they know, okay, here are my marching orders, this is what I'm responsible for.
Exactly.
Cool. Seems like it'd be worth it. That's awesome. What else? I don't know. I know we've kind of bounced around about the primary care side of things and advanced practice, and then informatics as well. I wanted to ask you this earlier. So the informatics team, well, I guess the informatics department, I guess maybe you should say, or I should say, started about 6 years ago. Is that right?
Yeah, the end of 2018.
Okay. How's it grown and changed since that time?
Yeah, I mean it's grown exponentially. I started just 8 hours a month of work, dedicated work to that, to now between 8 to 12 hours a week of administrative work associated with that. We've added on a registered nurse who works as the health, let's see, informatics optimization specialist. So he works with me to really concentrate on training, especially training new hires, as well as retraining different workflows, creating workflows. When we identify, process issues, going to those individuals and really concentrating on ways to improve that. And then in addition to that, we just continue to improve our efficiencies within EHR, as well as implementing, different tools like population health tools, in order to provide better outcomes for our patients. So it has significantly changed in the short amount of time since our CMO and president, Dr. Kowal, started the idea of a health informatics manager.
Yeah. That's awesome though. And I mean, it makes sense that it would be changing and growing, and there's going to be an evolving need. It's interesting. It's like the more we begin to depend on these systems that, improve care and make things more efficient, the more, so even though the systems themselves maybe become more efficient, it's like the more of a need there is for somebody to manage them more full time, maybe. Right.
Yeah, absolutely. I mean, the data that comes in and the data that we have to provide, it's always changing. It's always, Yeah, I mean, alternating and the way that we need to provide the different types of health measures and those types of things for patients, for insurance companies, for the government, those types of things. It's something that requires a lot of attention and something that, is changing all the time.
That's awesome. Yeah. So good that different organizations are being so proactive, right, with making these improvements and staying on top of these to ultimately make things more efficient and more sustainable for care providers, and then also to improve those patient outcomes. So that's exciting. Well, we're just about at the end of our time here. Is there anything else that we didn't touch on, or any final thoughts you want to leave us with?
I don't think we really talked about maybe the definition of health informatics.
Oh, yeah.
Yeah. We really talk about it being the bridge between IT and medicine. And that's a lot of what I do. But I also don't think or necessarily believe a lot of people understand that it's science, right? When we think about IT, it's a lot of troubleshooting and a lot of negative connotation on technology and breaking and causing problems. But informatics itself is a lot of science, and it's a combination, of computer science, information science, nursing science, and the analytics that surround it all in order to improve efficiency and get those strong patient outcomes.
Yeah, that's awesome. I shouldn't skip that question. I like that question a lot because everybody I talk to defines it a little bit differently. And I think that the reason for that is because there are so many facets to it. It's really challenging to find one thing that encompasses all of them.
Yeah, absolutely.
It's gonna depend on like your perspective, and your perspective is shaped by your role and how you experience informatics,
Right.
how it impacts your daily life, right?
That's right.
Cool. Well, Dr. Pykare, thank you so much for sharing your incredible journey and your insights with us. If people wanted to keep up with what you've got going on, is there a place where they could find you on LinkedIn or online?
Yeah, I'm on LinkedIn, and then my socials at Dr. JP, the NP.
Nice. Perfect. All right. Well, yeah, your dedication to improving healthcare through informatics and leadership, man, it's definitely inspiring. Super grateful for people that do what you do, right? Because like I said, we all consume healthcare. We all benefit from it. So thank you.
Thank you very much.
Yeah. So to our listeners, we'd love to hear your thoughts and experiences on this episode. Share your comments on LinkedIn or directly on the podcast website at pivotal.buzzsprout.com. And if you know somebody in healthcare or anybody at all who'd find this episode inspiring or beneficial, share it with them directly. They can listen live on LinkedIn or anywhere they get their podcasts. So until next time, stay tuned for more episodes here on the Pivotal Podcast.